finish up, just a couple of minutes today. Med math, remember if you got less than 22.5. Less than 22.5, just reach out to me so we can go through what we missed and then we can retake that. And then ATI, good job on that fundamentals exam. Remember we said if you got 2 or 3, you don't have to remediate, you get 0 or 1. So that would be a score less than 65.4. Less than 65.4. If you have questions, let me know. That will be due by your final. But so let's crank it out. You're talking about that. And then our final is on Thursday, May 8th. That was so fun on Friday to see you. I sent all the pictures that I took. I didn't get everyone. I'm sorry. Those that I did think that I got. What I did not get that I thought I got. So anyway, I sent them to Terry. She'll have them up on the board for this week. So good job. That was really fun to see you guys in that role, teaching me up. So well done. All right, any other things we should be thinking about or any other questions? Hey, speaking of EVP, we're gonna do a little study. Okay, so we are going to play Jeopardy. And whatever kind of candy you take, I have to be able to offer this again. I'll find them. I'm going to offer it on the day you take the final. We're going to see if you do better. Association. So I went to somebody was talking about let's go aromatherapies. Some of you guys did that. I thought it was interesting. This is kind of off that same lines. Like peppermint, they say like if you chew gum while you're studying and then you chew gum when you're doing your test or have a mint. There's something about peppermint. So I threw peppermint in there. There's also chocolate and kaijus and Kit Kats. So we're just gonna either take one and then I'll try to have the same one here on Thursday next week. Or if I totally forget. I hope I don't forget. Okay. All right. So we're gonna break up in teams. I think we're gonna split right between Grace and Allison. You're on this team. Peter, you're on that team. Okay. So 2 teams, right? You love this? You love Jeopardy? You love getting up in front of everyone and playing Jeopardy? Some of you were like, I knew. And if I knew that before your evals, it would have changed it. Okay, so team on my left, what's my team on my right?
No.
Pineapple. You're pineapple on the left. So okay, pineapple on this side.
Potato.
No, watermelon.
Johnny,
Watermelon.
give me the potato.
Okay, here we go. Now,
Give me $100.
I don't really care about the score. I will add points, but I don't really care about the score. So it's okay. This is just fun and it's to review material. That's really the whole point of it. Okay, so anybody want to go first?
You're crazy.
This is like, that's awesome. Just like get it over it. Yeah, that's awesome. Okay, so that's part of watermelon. Haley, you coming down? All right, here's the rules. Oh wait, are we mixed up? Pineapple, are you guys? Watermelon, are you guys?
Yes.
Yeah.
Okay, that's me. So there's categories of fluid and electrolytes. All things respiratory. Diagnostic. So fun. Medication. Illness grave. And the nursing process. Okay, so I'm going to read the question. And then after I finish the question, if you know the answer, you can hit the little buzz. It doesn't buzz, it just lights up. Okay. Slash. Okay, good. Okay, so come on over. And to this first question, I get to choose. I'm gonna go big.
You go.
Let's start out. A radiology procedure in which a special scanner allows conceptual images of an organ to be visualized. That is. Okay, so that's yeah, also computed tomography, which you don't need to talk about. Okay, awesome. What kind of things do you want to be looking for before someone goes for a CT? In general. It doesn't matter. So she said we're looking for metal possibly, but maybe that doesn't matter. That's correct. So not for CT, but for what? MRIs. Good job reminding us of that. What is the test when we should be looking at a lab value before they go register in contact? Yeah.
Korea.
Good. You and reaction. Awesome. If it's okay, good job. So take your little candy. We'll put who's the watermelon? You get the watermelon.
Yeah.
Okay, how
Good job,
much?
Amber.
Woo! Get one for it.
Whoa.
Question, they answered it. Okay, so when we first hit the button, I'm gonna have the people up here try to give me the answer. If they don't know us, then they will turn to you again. Okay? Is that good? You wanna come up? Aiden?
Sure.
Sammy, come on up.
Yeah, that's no.
Okay. Aiden, you get to choose.
Oh.
Team actively. Discovers the parental nutrition solution is not infusing. The nurse should monitor the client for which of the following conditions. I'll take it. Good job. Hypoglycemia. All right. So if that was a kid, what was I saying if I was a total TPN?
Insurance probably. Well, I think.
Okay, so did everybody hear that? So if you run out of TPN and you are hypoglycemic, what are you gonna hang instead? We're gonna go big. We're gonna go D10, D10. That's a very, very hypertonic solution. Okay, awesome. How much was that? 5. Okay, I don't know.
We should get.
Keep me honest. I don't pay attention to any numbers. Okay. I mean, you guys got it, so I don't know.
Yes, give me the 500. Yeah.
Careful of this.
No.
Yeah. Yeah. It's a social.
Maybe a few. This is wanna come on? It's smaller.
Not choose a fit.
Yeah, yeah. All right.
Like if I could see him.
Small, you get to choose.
I can't be sick.
Lunar electrons, all things used for diagnostic medication and build a grab bag. And there's some more.
Grab
All right, here we go. This is Karen Berkline, who has polycystic kidney disease. What are some clinical manifestations?
Oh. It was first. Molly was first. Yeah.
Hit them all.
Okay.
This is the one where they have the cysts on the kidney, so it'd be like bilateral.
Good, I like that. Bilateral kind of kidney discomfort. I like it. Good, like, hey, we got, but enlargement, bilateral. That's key, so good job, bilateral enlargement. Anything else? Yeah, probably muscular now, but pain, remember those cysts at birth, we can get kind of a smoky colored urine. That's distinguishing from CKD, but the bilateral nature of the connection is true. Let's see. Hypertension, that might be a sign that somebody is relatively healthy. Hematuria, pain, palpable bilateral enlarged kidney.
Yeah, sure.
Pineapple.
Everybody's away.
All right, let's do it.
I'm not the first one. Hey.
All right. Got that? Is all, okay.
Okay, let's do, let's do medications.
Meds. In a patient who's experiencing asthma, medication to be administered. Feels good, albuterol, awesome. What would be, that's something that we can give or like a daily maintenance to prevent? Equilibrium, good, Atrovent, good, anything else? Sure, that's, yeah. So what I'm looking for is a long acting beta agonist, so it's a combination between any kind of steroid. Betamethasone and like Flovent is the name of it. There's others, okay, so that's not what I would give for rescue breathing. Albuterol is what I would give for rescue. Good, awesome. Let's do it. Yeah.
Thanks.
Before steroid, before long acting. Okay, what was that, 200? Please next, does it? Sorry.
Yeah, I looked for Sam for an actual answer and froze out. That's not good.
Good.
Yeah, right, 1 kilogram in weight is equivalent to how many mLs?
Oh, what? No, right?
Hey, man. Red leader.
Yes, okay.
That's what I meant. I'm here.
My patient's weight, like, let's say my
Oh, I
dad's
read legally.
patient's weight.
Yeah.
Is normally 85 kilos. And they come in for dialysis and they're at 87. How many liters will I need to take off? Go back to. Third one. Two. Job, right now. Good job, good job. Good job, people.
Say it louder.
What was that? 200?
One.
Good job, Charlie.
Good job, one vessel and now for 1 liter is 1 kilogram. Good job. All right, Sam, come on up. Sit for a minute, come on up.
One.
Strength arms.
You step on my.
Yeah.
Oh, it's so. You gotta separate yourself. Medication's 500.
Yeah.
What is the medication used to treat malignant hyperthermia?
So God.
Oh, it's D. It's on tip my. Oh. Why am I saying?
What do you
I thought it.
No, I said it's on tip of my tongue. I don't know.
It's.
Smart.
It's.
I got nothing.
I'm pulling a blank, bro.
I love it to my right.
Anthony.
Anthony sodium.
Yes.
Yeah. First off, I got it was a thing.
I will Anthony. I will Anthony. That was a great Johnny, come on up. He's on. Scared. Okay, remember these. I see Anthony. All right. How about nurse the process?
He said he did see it.
The interventions post carotid endarterectomy.
You got it, John.
Yeah, watch for bleeding. First signs of bleeding, so probably like look for pallor, look at the blood pressure.
Okay, yeah, good. I love that you're thinking about the blood pressure.
Would you hear it? Oh, no. Before you would, okay,
Good, yeah, because there's a blockage sitting in.
so would you wanna reassess?
Good, good. Katie, you got a couple more?
Would you wanna like assess like mental status? And then, because if you have bleeding or like a blockage, they're gonna be not.
Yeah, if you're taking out a big piece of. Cholesterol or something, can it break off in like travel? Yeah, blood clots, stroke.
Sure.
Yeah, good. So, vital signs, good, heart rate, blood pressure, look for tracheal deviation, so that could be that you have a hematoma forming, that's not, when we talked about tracheal deviation before, that was something different. Cranial nerves, renal function, and maintain head in the neutral position, watch for signs and symptoms like stroke. Good job, people. Good job.
Go Dom.
Sit on. Good job.
Alright, dog. I can't.
Okay. How about all things respiratory 3 times?
He's ready.
A nurse is caring for a client who is unconscious, has a breathing pattern. characterized by alternating periods of hyperventilation and apnea. The nurse should document that the client has which of the following respiratory alterations. That's good. Oh, okay, that is. That's true, that's true. Not what I'm looking for, but I like how you're thinking about that. And
It's not.
like, never mind. Okay, so I heard Koo small, but what would Koo small?
Deep and
Deep and rapid. This is hyperventilation and then. I've not hyperventilation before, but I like that you're picking up on the
I don't
acronym.
know.
This is at the end of like.
The snake. I have no idea.
You'll hear that. This is good, this is good. Chain Stokes.
But not a not a
All right, so take a look at your number. So that is different than.
No, no.
But me,
Come on up, or Adam, come on up. No, no. You're like, oh, everybody give us a chain Stoke and the right, that's when you see that, or major neurological issue.
Yeah, I recommend.
Diagnostics 300. Which is screening for colorectal cancer for individuals older than 50. Colonoscopy, good. Anything before that? Yeah, good job, good job. Good job. Fecal occult, that's where we check to see if there's blood. Good job, good
good
job.
job,
Miss
Eva.
Emily, I'll give you a chance. What kind of prep would they need to do for a colonoscopy?
You have to take, what's it called, go
Go or something?
something like
Yeah,
that to empty the GI.
Yeah.
And then you, and I think you can drink water before. Hours.
Usually, yeah.
And then you're just gonna make sure they're not allergic to any of the stuff you're using, because you are also doing anesthesia.
Right.
If they've had any adverse reactions with that.
Good job, good job. It's just like conscious sedation, so they're kind of really kind of out. Usually sleep. Good. Good, so what would you tell your patient to expect when they're taking the light?
You're going that way.
Right, that's what we want, yeah, you're clear the path. Good job.
Way to go, Diva.
Good job, people. Sorry. Miss Ellie, come on up. Miss Davis. Good job, Miss Ellie, you get shows.
No, actually, we can move it. If they come in Tuesday.
Okay, Miss.
But
What is the name of the medication commonly used for patients with anemia and chronic kidney disease? Action. Me with my, oh, maybe.
Oh, that's a good one.
Jim. Right, so Evogen increases our red blood cell count, right? So people with anemia, like iron deficiency anemia, but I like the vitamin B12 for what kind of anemia?
Vitamin B12 deficiency.
Yeah, yeah. Right, do you remember what that's called? Pernicious. And chronic kidney disease, right? Not producing. Yeah, right. Got your candy. All right, next. This thing.
Like that's good. Maybe
There's your process five.
Okay. Like that.
Yeah.
Okay, so calculating, you know, how many mLs in one. Oh, no.
30. Oh, wait.
That is, don't doubt yourself. Good job.
Megan, you got that.
And when would you want a positive ion balance and a negative ion balance? I love so much progressive nature of that.
You would want a positive ion if. Positive? If they have like a fluid ozone, like you're trying to get rid of, no, opposite, deficit, okay.
So if they're coming in dry, like they've been throwing up for 5 days, they're coming in dry. I would want them to have a positive ion balance at the end of my shift. You know, I'm trying to replenish all that was. Yes. So a negative balance.
You're so hot.
If they have excess coming in, I will want them to be in the negative. So that's what the providers will tell you. They'll say, I want this person 1.5 liters negative by the end of their shift. Or within 24 hours, you want to be positive 1 liter. So that's where that kilogram thing comes in. Yeah, remember, tattoo. Right here. 1 ounce equals 30 ml. All right, hold it down. That was awesome. Okay.
Let's do grab bags or 200.
Okay, here we go. A nurse is caring for a client who is receiving peritoneal dialysis. The nurse should monitor the client for which of the following manifestations of peritonitis. Extensions. Good, so pain, not numbness. Remember I asked you that question, I put numbness on there. Don't choose numbness, it's pain and it's distension. Need a couple more?
Like. One.
Sure, like a
Yeah, fever.
fever, yes. And what do you think the output of the diastolic solution will look like? Cloudy. Okay, so did you hear all those 4 things? Those are the 4 things I'm looking for. Cloudy output, fever, distended abdomen, tenderness. Okay, not numbness, it's painful. Okay, awesome.
Let's go.
And as you vomiting can also be double tenderness, and confusion, fever, and cloudy output. That was a question you already had. All right. Come on down. No? You want me to choose? Like, no? I don't know who that is. Okay. Yeah, Joy, go ahead.
Nursing process 200.
A patient is at risk for injury when having a CT with IV contrast. Why? Or what do we call a medication that is kind of. Never shots it, good job, awesome. So what blood test am I looking at? Being in creatinine, and if it's, okay, don't do that yet. What are you going to be watching for after this? If they're being in creatinine are just a little bit high, we go ahead and send them for CT, we give them contrast through the IT. What things will we be watching for? Yeah, so like decrease urine output. Retention. Electrolyte imbalances and bumping of that creatinine. Yeah, IV contrast and nephrotox. Assess if you had a creatinine prior to the test. Encourage PO and IV fluids, monitor INO. Alignment. All right, yes, come on down.
Like, wait.
Yes, what do you think?
Nursing process 400.
Okay, so the process 400. Name 3 common intraoperative positions and the pressure points you would be worried about for a potential injury.
We have supine,
Supine,
which you would want to be worried about, like the head, neck, and then the heels,
good.
and then your back,
But-
yeah.
Mhm, mhm. Good,
And then doing
I was just gonna say, maybe forehead. like
Yeah.
Shoulders.
Good.
like pushing down.
Good.
Hip bones.
Yep.
They're like. So.
yep, top of the foot, knee, everything that's up against pressure. Yeah, good.
and then lithotomy, you want to worry about again like the butt, and then that you're having correct, like they're still having blood flow to the feet, so you want to be checking like pedal pulses and also heels because you're in like the stirrups. Yeah.
Temperature, cap refill, yeah, good, good, awesome. So supine, developer, reverse developer, prone, shoulders, lateral, bottom, jackknife, so. Think about if you were in the OR, what pressure points you'd have to be worried about, good job. That was 400. Low ball. Low ball. Right, Grace, which one you feeling?
Yeah. Straight there.
Illness grab bag 400.
All right, illness grab bag 400, here we go. Name constitutional signs of cancer.
Ooh.
It's high, okay, you
go
two.
first.
Like, swallow, these are nice ones.
Yeah, night sweats, good, difficulty swallowing,
I was gonna say like maybe a productive cough.
yeah, good. Or, yeah, it can be a productive or a non-productive cough, you know,
Oh, okay,
just a,
okay.
just a cough that hasn't gone away for 6 months or so.
And then maybe like abnormal bowel. Like, they can't digest, maybe they've been having bowel problems for a long time. I know that can happen with colon cancer specifically.
Right, changes in bowel habits.
Mm-hmm.
Yeah, unexplained weight loss, good, night sweats, fatigue. So these things specifically constitutional signs are like vague symptoms. It could be a lot of things. But when we hear them, we should put in the differential that maybe this is a sign of cancer. So like that, unintentional weight loss, low-grade fever, night sweats, fatigue. And then when we're thinking caution for some of those other things like bowel changes. Changes. Good job, good job. Careful, no injury.
Wow.
Been kind of. that was a total tie, so I get to choose. How about diagnostics for 500?
Alright.
She loves the diagnostic.
What are the normal values for CUN, creatinine, and GFR? Bumping it up.
Nice.
Nice.
Good job, good job. Gosh. That was on your goal. CUN 8 to 20, creatinine 0.4, 0.5, 1.2, and GFR anything above 90, 120 is normal. Okay, then we can grade them as it gets lower and lower and lower. Right, 1 through 5. Awesome. Good job. Are you pineapple? No. It is. I mean,
Everyone's.
39. Everyone's pretty good. Okay. Here we go. Are you feeling it? We got that?
This time on this.
All things respiratory fibers. A patient with COPD has emphysema and chronic bronchitis, which results in inflation of the alveoli and excessive mucus production when you cough. This is totally my kind of question, people. What SpO2 and KO2 levels do you expect?
With COPD, we would expect to have like CO2.
Top. Really good job. So, what kind of ABG values do you think you would see for PaCO2? Above what number? Okay, so anything over, the PaCO2 is gonna be over 40. And that's how they run, right? And your SpO2 levels or SaO2 levels will be low. Because we're talking about hypoxemia, right? So do we put oxygen on these people?
Yeah.
A low level, yeah, good job, good job. What am I trying to maintain their O2 saturation? 88 to 90, good job, good job. 80, 90, 91, that's fine. But not 95, not 96, not 97. How come?
They will not.
They use CO2.
They won't breathe anymore.
They won't breathe. Because they are not picking up on their CO2 levels. They are already high. They pick up on their low O2 levels. You jack that up. They can't say like, oh, I'm flush, I don't have to breathe. Okay, so we have to treat hypoxemia, just watch how much. Yes. Nice, nice. Low SpO2 because carbon dioxide cannot leave the alveoli and oxygen cannot enter. Okay, so we have respiratory acidosis. Good job. Good job. How much does that work? 500.
Hey, come on now.
Come on. Show off.
We're just gonna go all 500 milligrams, right? They're passing lines into the injection.
Abdominal pains.
Pain, third, something very classic, because nausea and vomiting is like, you know. Yes, yes, and what will you feel when you're like? Sausage like. So it's sausage like shape because of the little telescoping that's happening in the intestine. Good job. Any other classic sign? Yeah, good job. Good job. Colicky, abdominal pain that causes the child to scream rather underneath the abdomen. This page got the current belly-like stool, very distinguisher, and then Melissa got the powerful spot, which shapes cat and the right pepper quadrant. Good job. Okay, how we do? Has everybody gone? That's for 400.
Okay.
I think.
Okay.
Well, I just touched the wrong thing. Prior to obtaining an APG, the Allen test should be performed, describe how this is done.
We're gonna include your radial and your ulnar
Good, and, okay, good job. What do we have to do after someone gets a ABG done? What is the nurse's role? Oh, right, so it's our job, like, we have to go in there, our RT will go in and get the sample, we're there holding it for 5 minutes. Yeah. Okay, so bleeding is a big deal, good job, and perfusion, so doing the Allen test before, yeah, good. Yeah, both the radial and ulnars, have the patient clench their fist, then on opening their fist, remove pressure from the ulnar to see if there's perfusion. So that means if I blow through the radial, I still have perfusion to their hand. That'd be bad business, if you lose their hand if we don't do that. Awesome. How much is that? Let's go do the last ones together. Take through the electrolytes for 100. Serum sodium level, go.
135,
Okay, potassium. Okay, 530, good. Chloride.
97 to 107.
Good job. Meg.
2.5.
Say it again.
1.5 to 2.2.
Good. 1.5 to 2.2, and then phos.
Oh, nice.
Say, Joe.
2.5 to 4.5.
Good job. Glucose.
That's the one.
Fasting. Wait,
Yeah, 70 to 120, 70 to 120, good. VU and creatinine, we already did that, your chemistry panel, well done. Yeah, we see. Isn't that so fun? You did not know that. Like 12 or 15. All right, treatment for hyperkalemia. My goodness, how many times have I asked you this question?
Insulin, glucose, KX,
Okay, if we have time, what are you gonna give me?
KX.
KX late,
And then
okay? That's gonna make me poop and I'm gonna poop out potassium. Okay, awesome. But let's say I'm having arrhythmias because of this.
insulin.
Insulin
Dextrose.
and dextrose at the same time. IV insulin, IV dextrose. What does that cause?
The potassium comes into the cell.
Good, so it's in the bloodstream and we push it into the cells. It's a temporary fix, but then it gives us time to like bring that level down, so we hope that they're not having arrhythmias. Yeah, good job. Good job. Yeah. Nurse care for a client who's 1 day post-op following a subtotal thyroidectomy. A client reports tingling sensation in the hands, soles of the feet, and around the lip. Which of the following findings should the nurse assess the client?
Yeah, it says.
Hypocalcemia, correct. Good job. What, oh, we didn't say the level for calcium.
8.2 to 10.2.
Yeah, 8.2 to 10.2 or 8.9 to 10.9, right? So hypocalcemia, anything less than 8. What is it when I tap on the facial? And what's it when I check the blood pressure? So signs of hypocalcemia. All things are great. What is the flow rate for a nasal cannula?
2 to 8 or something.
2 to 5.
6, okay, 1 to 6, 1 to 5. We will know this by Wednesday. Right? Okay, and then simple face mask, if I had to go above that. 5 to 10, good job. Partial rebreather, or we'll just say a rebreather,
It's like
8 to 12. Non-rebreather, yeah, 10 to 15. Bag valve mask,
Highest.
the highest level. Okay, so when you're doing suction form,
That's a fact.
you're not going to put it on one, you're going to put it all the way up. Okay, okay, 15, 10 to 15. 15 is the highest flow meter can go. Okay, everybody good?
Venturians?
Venturi mask, yeah. How do you know the Venturi mask?
That's the sewer Pacific Sea.
Yeah, look at the bottom, the little end, look at the bottom, and it tells you percentage and flow rate. Okay, that was a question on your midterm. I had that Venturi mask there and I said, how many liters should this be set for? You had to look at the bottom to see that. Okay, if I do that on Wednesday, it'll be red. What is it called when the pH is greater than 7.45 and pH 2 is less than 7.25? Everybody good? What do we call it?
Respiratory.
How do I get that?
Because they're opposite. Oh, how do you get it? Oh. Yeah. You're breathing.
You're
You're
not
breathing off
No, you haven't.
or vomiting, right?
You haven't too deep breaths, so you breathe.
That's what it's called. We call it
Hyperventilation.
Yeah, you're blowing off all these fumes. Okay. Under care for a client who has a chest tube connected to a wet closed drainage system, needs to be transported to the X-ray department. Which of the following actions should the nurse take?
Just too loud.
So. You're placing it on a chest tube. You're gonna just disconnect it. No.
Can you put this safety?
Bring the whole thing.
Bring the whole thing, that's right. Bring the whole thing. Keep it below the level of the chest tube.
Yeah.
Okay, so it's still hanging off the side of the head. Don't raise it up like this and have drainage back to the side of the chest. Like the Foley catheter, keep it below the side of the head, yeah.
So it's connected to like the suction on the wall, so then what would you connect it to? It's.
Yeah, you just disconnect, remember that,
Oh.
okay? When we get back, then we can put it back in. Yeah, good job. Okay, that's a good thing to know,
Good job,
I think we would get
Joe.
nervous, like maybe I can't do that. Diagnostics, what test is used to detail?
What's salt?
Chloride test.
Hey, well, that's salt in your
Right,
sweat.
right, fluoride, so if I put sodium, which I did,
You did.
Indubitably.
sweat fluoride test measures the concentration of fluoride in the patient's sweat. Normal is 30, anything greater than 60 indicates cystic fibrosis. It lets the sweat off the baby's arm.
You failure to throw.
What is the reversal agent for heparin?
Oh,
That's correct.
oh.
It's protein sulfate. If anybody gives it, yeah.
Sulfate, this is the only question I remember from my NCLEX, guys. So I'm gonna ask, I don't know if they're still asking that, but you need to know it. So what is the reversal agent for Coumadin? Vitamin K. Warfarin, right? Okay, good job. Warfarin and Coumadin are the same thing. So vitamin K for that, protamine sulfate for heparin. Good job. Okay. Type of insulin that is considered a basal insulin. This is something that's going to take you for hours to make sure that you have some insulin. Some insulin.
Just when you take the warning, this lasts a long time.
Sally? Lantus or Glargine, yes, that's a 24-hour one, good job. And then, I heard it down here. NPH, that's your 12-hour one, okay? So that's what's going to hold you And then when we do our sliding scale, that's the fast act. Not basal. So SPH or chlorogene, Lantus, same thing as chlorogene. A nurse is assessing a client who has a long history of smoking and is suspected of having laryngeal cancer. The nurse should anticipate that the client will report that her earliest manifestation was.
First.
Good job. Hoarseness. Difficult swallowing might come later. Hoarseness. Nursing practice for 100. A nurse is assessing the client who reports numbness and pain in his right palm, index finger, and middle finger. Oh yeah, the client reports working with the keyboard a lot at work. So nurse is got a carpal tunnel, which the following test should the nurse perform as part of the assessment.
Oh,
We didn't talk about this, but it is under musculoskeletal.
no idea.
Yeah. Yeah. Balance.
Okay, she ate.
So you go like this
Okay.
for about, I don't know, 30 seconds. If they have numbness in their fingers, that can indicate carpal tunnel. There's also when you tap on the median nerve and they have numbness in their fingers. You can also do actual electrode test. Okay, so what do we do for people with carpal tunnel? Might try like braces, but then they can go in and do surgery to open up that space so that the little median nerve is not compressed. That's what's happening. It's inflammation. Good. There's one question that I don't. Oh, how do you get? Winner is.
Yeah, you have.
You're all winners. One last question. How would you get metabolic alkalosis?
Throwing up.
Suctioning or throwing up. It's the same thing. It's either we're taking it out of someone or it's happening naturally. Okay, what about metabolic acidosis? Diarrhea. And one that has it in its name, diabetic ketoacidosis. Good job. Awesome. Any other question? PK, HH, no difference between double.
Wait, what's the HH?
IV fluids, hypotonic, isotonic, how to give blood. All that you've learned. That's awesome. Well done. Thank you. I will see you Tuesday tomorrow. That's so beginning, man.